The following program contains mature subject matter. Viewer discretion is advised.
A condition called Peyronie's disease that causes a curvature of the penis can be painful, it can certainly be embarrassing, but could a new procedure that uses sound waves bring relief? Joining us with a closer look is urologist Dr. Judson Brandeis. Steve, who received this treatment, and his wife Teresa also join us in the audience. Welcome to all of you.
Welcome.
So, first things first, Peyronie's. A lot of people haven't heard of this, and totally devastating to a man who's experienced it, potentially his partner as well. So this treatment, as you kind of explained Peyronie's to us, how does this new treatment work?
So injuries occur to the penis, and sometimes patients don't even recognize it. So 80% of the time, there's not even an episode that patients can say, this is how it occurred. But it results in scar tissue. That scar tissue constricts the ability of the penis to increase in size. It results in pain, in curvature, and in shorter penis.
And so this therapy helps break up that scar tissue.
So the shock waves are actually breaking up the plaques in the blood vessels? That's the proposed mechanism for this?
Exactly. Well, there are two different mechanisms. For Peyronie's disease, the scar tissue actually breaks up the plaque. And it results in a remodeling of collagen in a way that allows it to stretch better. With erectile dysfunction, it stimulates the growth of new blood vessels. When you have new blood vessels, you have better blood flow.
All right, so that's the science. I want to know about the day-to-day. Steve, you've had this treatment.
Yes.
How have you been since the treatments?
I'm great now. For the last 6 years, I had like no hope. There's really hasn't been any treatment for it that I have come across, and now I'm pretty much back to my old self.
How many?
Right?
And I love, Teresa, I love the smile on your face.
Yeah.
So can you tell us a little bit about your experience as a
Well, we met later in life and fell in love and, you know, really happy, great life, great sex life. And then just a couple years into our relationship, this happened. And, you know, there really didn't seem to be any treatment. And he, you know, felt hopeless and depressed. And it totally affected, you know, even though I could tell him over and over that it didn't matter to me, it totally affected how he felt about, you know, having sex or, you know, how it looked or whatever. And so it definitely changed that part of our life.
And it can be painful for not only the male suffering from it, but obviously it can make intercourse difficult and painful for the woman. Real quick, how many treatments total do you have, Steve?
12.
12 treatments.
12 treatments.
And every time probably a little bit better and better as it remolds in terms of the scar tissue?
But the amazing thing is each treatment's only 20 minutes, and it's not painful at all. It's the first treatment for erectile dysfunction that doesn't involve pills, doesn't involve shots, doesn't involve surgery, and it can give couples back their spontaneity.
Really
Sounds good to
quickly,
me.
what's the cost compared to other treatments?
So it's $3,000 for the full treatment. But you know, the amazing thing is the two other treatments that actually work, either a shot of an enzyme costs $20,000, and surgery and surgery can be even more than that.
And surgery, let's call a spade a spade. If you can avoid surgery on the penis, I'm gonna go ahead and say that I would rather have a 20-minute procedure where it doesn't hurt.
Fair enough.
Steve, we're so happy for you and Teresa. Thanks for sharing your story.